I'm so pleased to have Marcia Proto with me. She's Executive Director of the CCNW and CLN. So great to see you, Marcia.
Thanks, Mabel. I'm so excited to be engaged in spearheading this huge healthcare and nursing workforce summit today.
How significant is this group meeting together today?
So to tell you the truth, Mabel, this is the first time we've actually convened healthcare in general. Usually we've been focusing on nursing and our nursing education pipelines. We know who's in our pipeline to become a nurse. We know our supply of nursing and nurses and where they work. And this is the first time that we've actually reached out to practice settings, hospitals, home care, long-term care, primary care, behavioral health, to really find out what their workforce needs are. So we're really excited to be sharing not only the workforce needs in nursing, but up to 40 other roles that our healthcare system supports in Connecticut. So really the goal is to create a robust and sustainable healthcare workforce for Connecticut.
Absolutely. There are some very serious issues facing your sector right now.
Very much so.
And what are some of the questions you're going to try to address while you're meeting?
Sure. Well, today we're very excited that our workforce development boards, all 5 of them, have supported this initiative as they really look within their regions to get individuals into the workforce where their geography dictates where the need is, whether it's healthcare or manufacturing. So we know healthcare is a growing sector in each of these regions, so they're very excited to participate. And then we were also able to align ourselves with all the state healthcare associations, those that represent hospitals, long-term care, home care, assisted living, so they could actually engage their members, which are all of our providers, to find out what their needs are. So this is the first time we've been able to convene all the entities, not just one sector, to really find out what our workforce looks like in Connecticut and where those gaps exist.
And Marcia, you've been at your job for almost 10 years
yes,
now?
a little over 10 years.
Big changes have just happened. Tell me about those.
Very much, and I think as our organizations have evolved, we started as the Connecticut League for Nursing, really focused on nursing education and faculty. And then there was kind of a vacuum in the state of Connecticut for workforce-oriented programming and education. And so we dove into that market. We run a national RN refresher course for those nurses who have their license but have been out of practice a little bit. Employers won't onboard them immediately, so they take our refresher course. Mm-hmm. We've also seen the need for educators in our colleges, universities, especially clinical faculty. And those are the professionals who take our student nurses into their clinical experiences that are part of their undergraduate education. And so we now run a national clinical faculty course to help prepare nurse faculty who are at the master's level to be teachers. So we're excited about that. And then we've just started to morph into a lot more data collection for education and supply. And so we've created our own nursing workforce center that's been in existence since 2013. Okay. And so very excited to share that we incorporated ourselves in August of 2018, and just July of 2019 secured our 501c3 determination by the IRS. Wow. As a full-fledged nonprofit. So we're really getting to ramp up for not only foundations in Connecticut to secure funding to support us in workforce development, but now we can go out nationally to HRSA and other major funders to really look at how we can move and develop workforce planning in the state of Connecticut for all of our healthcare roles.
What sort of changes or opportunities will that afford you now that you have this additional designation?
Before, due to not having a nonprofit status, many of the healthcare grants, even from local funders, they would only fund a 501c3, and without that designation, it gave us very little latitude to secure funds. We have programs and services that we generate revenue, but nothing to the extent of really putting together a demonstration project or pilot project in a certain sector to really enhance the workforce, so whether it be nursing and or healthcare. So with this distinction, we now have a wonderful opportunity. We have phenomenal resources and talents and practice partners in universities and infrastructure, but getting those dollars to really coalesce around an initiative initiative to see how these projects bear out and can positively influence the workforce sector. We're excited to engage in that work.
You have a lot of data available to you
Yes.
to really get a handle on where the needs are,
Yes.
what roles need to be
Yes.
filled. But are the correct organizations getting a hold of this data? Are you talking to one another about what needs to be done? Or is this siloed in different areas?
So it's funny that you mentioned that. Really, to date, we've been very siloed. Hospitals would just look at hospital data, long-term, just long-term data. We, as we came out of the nursing area, would look at nursing data and nursing roles. But I think we really need to look broader, especially as care is given in teams now. We need to be really cognizant of what are those team members, what are those physicians, those therapists, those social workers, nurses and techs, because they all act as a team to provide the best patient care we can give in Connecticut. And so I think if we look at one silo, as we've been looking at, Mabel, we've never been able to move the needle. And I think with the conversation of healthcare development and a sustainable healthcare workforce, we're getting so many more people at the table. For 15 years, we've been publishing nursing data, white papers, recommendations of what we can do. Yet I think just nursing was looking at those reports and not healthcare in general. And so I think today is a wonderful opportunity. We're bringing together all those partners. We're bringing together policymakers, Department of Labor, our Office of Healthcare Strategy, state legislators, community health, to really listen with a big lens today to say, how do we address this together? And I think we'll be much more successful in addressing it together than in a siloed way.
Does it hurt the state that you don't have a chief nursing officer that is really in charge of getting things done and giving the okay for certain programs to move forward?
It's very interesting that you mention that, because many states do have a paid chief nursing officer or healthcare professions division. We actually don't have that in Connecticut. We have a great board of nursing who really oversees licensure, regulation, and quality of care as it impacts our patients. But as for an overarching workforce planning, we don't. And I think without that voice, it's been our organization, the Connecticut Nurses Association, as well as other professional nursing organizations in the state, to be that voice. But I don't think we've coalesced as we could if we did have one centralized point to do this work.
What is the agenda or the priorities of the CCNW and CLN as you move forward through this year?
Sure, and I think the Connecticut Center for Nursing Workforce, or CCNW, really sees itself as a convener. We are a member of the National Forum of Healthcare Workforce Centers, and even though it's nursing-centric, many of the states are actually health professions centers, and I think that's where we would like to go, really looking at all of healthcare, because as I said earlier, if we don't do that, we're not going to be successful.
Okay. I'd like to sort of summarize this by asking you, we'll be asking other speakers this as well, what does Connecticut need to do to move forward in creating a robust and sustainable nursing workforce? What would you like to see done?
Yes. As a small state, this is definitely doable. And I think it's opening the conversation, especially between colleges, universities, and our practice settings. Really looking at, and I had shared with you, we only accept 25% of our qualified nursing students into education. And so we're leaving about 7,000 qualified nursing students not eligible to enroll in a program. So really looking at, do we need to expand capacity? But if we expand capacity of our nursing programs, are our practice partners willing to expand their clinical placements, be true partners in onboarding our nurses? And so really together creating a plan of how to do that. Since we have data in the nursing sphere, we could almost create a model of how we're doing it in nursing, which could easily flow through to all the other allied health programs, whether it be respiratory therapy or occupational therapy, physician assistant. So I think it's creating that one sustainable model where we have buy-in from all the partners that is going to make us successful not only in nursing, but the other health professions in the state. With really bottom line, making sure we provide quality and safe care to our residents, as we have a significantly aging population in the state. Many are not migrating down south anymore. And so how are we going to have the infrastructure to provide all those services? And it's going to be interesting because, as you know, with reimbursement, care is going to be provided out of the hospital. So how are we going to look at educating all of our healthcare professionals in the area of community health, social determinants of health, geriatrics? So it's a whole new lens in which we need to look at our need, create effective educational pathways, and onboard and partner with our practice settings to make sure those new people are fully onboarded and also are retained. And I think that's a huge issue that we're looking at, keeping the people that we have employed in Connecticut and providing the great health care that they do.
Do you think care has been impacted at all by how the situation is right now? You're looking for some improvements and some advancements in your programs, but in the meantime, have residents been hurt at all?
I don't know if it's by the care they're given or by the insurance and different policies and practices of how they want to move people from one setting to another, maybe a little quicker than they should. And I don't know if our practice settings have really put in all those safety nets. So when they do discharge or transition a patient to different level of care, has that handoff gone well? And are those patients and families on board? And that receiving entity, do they have the infrastructure to be successful? So those are some great conversations that we will continue to have and look to make sure that the safety and quality of care that we provide to our residents is as best as it can be.
That's terrific, Marcia. Anything that I've missed that you'd like our audience to know about?
That our organization could not be more excited about today. This event has been in the planning for actually 2 years since I heard of one way to gather demand data in a qualitative and a bit quantitative way. We've tried to gather demand data for 10 years in a quantitative way. How many openings do you have? Who do you need? And we really weren't getting any response. But looking at it to what are the needs, what are the perceived needs, where are you finding some potential shortages, where have you had to change your onboarding to make sure that that new hire was able to hit the ground running. With the new tenor and conversation, we've been able to engage so many more partners than we ever were before. So very excited to be really having this summit to begin the exchange of ideas. We have Dr. Dave DeLong, who's a national speaker on workforce strategies. We have Larissa Africa, who's the president of Versant Holdings, who's going to be sharing how to create that culture within your organization to promote effective onboarding and how to engage your existing staff in preceptor roles and education roles to retain them. And then we're having Dr. Sue Skillman from the state of Washington report out on our Connecticut data. She's going to share those roles that are going to be in need for us and begin the conversation of how we can create a systematic process for that, how to really invite people to be part of an advisory council to look at healthcare and nursing, so we really can dig deep and find those strategies and solutions to move forward. So this is going to be a great day, and I'm so excited that we're the convener of the event.
All right, Executive Director Marcia Proto, thank you so much.
Thank you so much, Mabel.